हेलो स्टूडेंट। आज हम पढ़ने वाले हैं अबाउट ड्रग यूज्ड इन द ट्रीटमेंट ऑफ माइग्रेन। माइग्रेन इज ए न्यूरोलॉजिकल डिजॉर्डर बेसिकली कैरेक्टराइज्ड बाय एक्टिवेशन ऑफ योर trigeminal system. Trigeminal is our fifth cranial nerve. Okay, due to activation of the trigeminal vascular system, as well as there is a dysregulation in your brainstem which is responsible for the pain function. Okay, so due to all these events, there is a release of a substance called CGRP, calcitonin gene related peptide. This CGRP basically acts by causing cranial vasodilation. Due to that, there is a development of migraine. Okay, so our 14% of world population basically affected by migraine. Okay, so migraine can occur at any age of your life. Females are more susceptible for migraine as comparison to men. If we will talk about the female to man ratio, it is around 3:1. Okay, so there are several factors that can induce the migraine. That includes, first one is some environmental factors like light and sound, some food like alcohol, chocolates, cheese, that can also induce migraine, and some factors like disturbance in your sleep, stress can also induce migraine. Okay, so symptoms, if we talk about the symptoms of migraine, so the hallmark system is headache. So this headache may be unilateral, one side can affect the one side of the brain, or maybe bilateral, it can affect your both side of the brain. So after headache, the patient may experience with aura, neck pain, nausea and vomiting. These are the few symptoms that are associated with migraine. So let us discuss about the treatment strategy. So whenever we are discussing any disease, so our treatment should be taken in two parts. That is, first one is your acute treatment, second one is your prophylactic condition. So acute treatment can be given by three important drug which can be easily remembered by a simple mnemonic: BET. So B for butorphanol, which is a opioid analog, can given in the treatment of migraine. Then E for ergotamine. So ergotamine is a drug which basically obtained from the ergot. Ergot is obtained from a fungus, Claviceps purpurea. Okay, so this ergotamine having alpha partial agonistic action in alpha receptor. Due to that property, it is given to treat this migraine condition. So along with ergotamine, another substance can given, that is caffeine. You know that it is a CNS stimulant which absorbs the which increases the absorption of ergotamine. Okay, then BET, T for triptans. So triptans is a class of drug which basically act by agonistic action on 5-HT1B 1D type of receptor, which is considered as a drug of choice in the treatment of migraine. Okay, so drugs comes under this class are sumatriptan, fabotriptan, all the triptan class of the drugs. Okay, so but there is one contraindication associated with triptan class of the drug. As you know that vasoconstriction is one of the important cause in the several vasoconstriction involved in the pathophysiology of several cardiovascular disorder. So that's why it is contraindicated in several cardiovascular disorders like coronary vasospasm, ischemic heart disease, hypertension, pregnancy, liver and kidney failure. Okay, so all this about the acute treatment. So let us discuss about prophylaxis. So the the migraine prophylaxis can be carried out by several drugs which can be easily remembered by a simple mnemonic: please act mindfully. P for propranolol. Propranolol can be given and it is used as most commonly used drug for the treatment of migraine due to its non-selective beta blocker property. Then please act. A for amyltriptyline, which is a tricyclic antidepressant. C for clonidine, which is used for the withdrawal symptoms. Then again in case of C is calcium channel blocker. One special drug that comes under calcium channel blocker that used in migraine is flunarizine. Then T for topiramate. Topiramate is a anticonvulsant drug which basically given during this treatment. Again, one important drug that comes under C is, I forgot to mention you, that cyproheptadine. Cyproheptadine is a 5-HT antagonist which also given in the treatment of migraine. Then M for methotrexate. Methotrexate is also one 5-HT antagonist which can be given for the prophylaxis of the treatment in case of migraine. So that's all for migraine. Thank you.